you take whatever Kwaku presented earlier, replace the word cataract and glaucoma with keratoconus, and you have mine. Not quite. So I'm going to try and give you a slightly different perspective on a machine learning model that we built for keratoconus detection using photorefraction profiles. This is joint work done between the L.V. Prasad Eye Institute and the Indian Institute of Technology. I acknowledge my co-authors and the funding agencies. Financial disclosures-wise, we do have a couple of IP applications in process for the work that I'm going to be presenting. So this audience doesn't need a great detailed explanation on keratoconus, but for completion's sake, this is a disease of the cornea where the shape of the cornea progressively degrades over time, affects children in the early teenage, and then continues to progress, leading to severe visual impairment and eventually needing corneal transplants and stuff. Now, if we identify patients with keratoconus who come to our clinic, we know how to arrest the progression. We also know how to optically rehabilitate them with contact lenses. The problem is, how do we even identify these individuals who are not showing up in our clinic, especially in resource-constrained environments like where I work. So present ways of screening or diagnosis relies on all these fancy equipments, your tomographers, your topographers, which are bulky, expensive, requires a trained human resource, practically unamenable to screening purposes. So this is where we were thinking about things, and a few years ago, we considered the use of infrared photorefraction as a possible way of identifying keratoconus. Now, photorefraction itself is not a new technology. This is a 4-decade-old technology that involves shining infrared light into the eye and looking at the reflection pattern that's formed across the pupil. This technology, the commercial versions of this are the ones that are currently used as gold standard ways of screening refractive errors in children. The question is, can we extend this technology to also identify abnormally shaped corneas, keratoconus being one of the major ones in that category. So just to give you a hint of what I'm talking about, here are profiles of photorefraction. The top panel are all from normal eyes, but with different amounts of refractive errors. What you see is the central panel, the panel B, which is emetropia. You see a uniform illumination of the pupil by the IR light, but once there is a refractive error, that is replaced by a nice luminance gradient going from the top to the bottom of the pupil. One way I wrap my head around this is, if you think of emetropia as a flat top cake, with the presence of refractive errors, it becomes a slopy cake. The slope becomes steeper and steeper with refractive errors. In contrast, when you look at the keratoconic images, the same cake no longer has that nice slopy appearance. It seems to be an excavated cake. The periphery seems to be steep, and the center seems to have gotten excavated out. So the pattern of reflex in photorefraction seems to be very different in keratoconus compared to controls. So this is a classic image processing problem. So question is this amenable to AI/ML modeling? Can we get better diagnostic accuracies once you model it using these systems? Bear in mind that the goal for our application is to develop an AI model that is a small number of parameters that can be used in less intense microprocessors like Raspberry Pi and stuff. So all the fancy models that Kwaku spoke about earlier, we are going to move away from that and develop an easier to apply ML model. So once pre-processing, this is the entire workflow of our model. Once the pre-processing is over for the 239 eyes with keratoconus and 199 controls, we've got a lot more data now that we are putting the model through. Ground truth assessment happens with experienced clinicians who are used to seeing these models. And then we dwell into two different AI models. One, an ultra lightweight convolutional neural network model, primarily for classifying these images into keratoconics versus normals. And a second UNet++ model that's meant for identifying geometric features that can differentiate a keratoconic pattern from a controls pattern. So the results are very promising for us. The ultra lightweight model has training and validation accuracies of close to 95%, and a classification accuracy with precision and recall hovering around 86% for all severities of keratoconus. The unit ++ model, meant for identifying the geometric shapes, is very clearly able to distinguish keratoconic from controls. And you can see that in the scatter diagram between the coherence between these patterns. So in conclusion, I think the infrared photorefraction profiles may be successfully modeled using AI/ML modeling approaches for differentiating keratoconus and controls. The ultralight CNN has good training, validation, accuracy, and precision, amenable to implementation in Raspberry Pi sorts of microprocessors. We are starting to work with commercial entities that have photorefraction technique to implement this technology onto them so we can extend the use cases of the existing photorefractors. The unit model gives us a lot more details about what this pattern of keratoconus is looking like. So we want to use that to go ahead and train these models additionally for even better results. So thank you very much, and it's an honor for me to be here. Thank you.